Normally, all right. Normally, we are in a new building on campus, which we're really excited to move into. And we do both individual ongoing therapy for brief therapy. We do a lot of groups. We do workshops. We do outreaches in classrooms. We also do a lot of crisis services. So if students are in need of help immediately, they can walk in during business hours or call us after hours. Um, and so those are kind of the main. We also consult with professors. Parents are welcome to call us. So that's kind of we try to hold the mental health of the campus of kind of everyone there as best as we can. And we work with and refer to and take referrals from the other units on campus, like Residence Life, Disability Services, the Health Center, tutoring, lots of places. So the way we've adapted that to the current situation is that we are still doing ongoing therapy, and we encourage people. We usually have a lot of people come in the beginning, so we encourage students to give us a call at our normal number. We have the wonderful Tara answering the phones, and she will take some information and we'll get you set up with a meeting with a counselor. We're also getting our groups started, and we're going to have a lot of different topics like we often have grief groups, anxiety groups, depression groups, groups for kind of certain populations that kind of have a common experience on campus. Often we have a Women of Color collective group that's been running for a number of years. We often have sexual assault support groups for survivors. So we'll be getting that going, and as we know kind of exactly what groups we're doing and when, we're going to try to disseminate that as best as possible. Through email, and also we have an Instagram account, which I believe is SSU_CAPS, C-A-P-S. I hope I'm not wrong on that, but I think that's what it is. If not, you could probably search it. So anyway, we're trying to get the information out there, but we encourage folks to come to us for counseling. We do, just like when we're on campus, we do emergency counseling. So folks can always call kind of our main number, 707-664-2153, whether they're in need of counseling services right now, or whether they want to set up maybe an appointment in a few days for ongoing therapy. But it's best to get that kind of set up at the beginning of the year, and then we can kind of figure out how that's going. And we do brief therapy, so it's not something that's going to be kind of every week all year long. Sometimes that's what students are used to, kind of coming from high school or coming from seeing an outside therapist. And we can get people kind of connected with outside therapy or find something that kind of works for them. But we kind of see ourselves as like the first place to go for mental health needs. And then we can make sure that you get connected to where you need to be connected to. I guess one thing, kind of a couple things specific to parents, is that we'll often get calls from parents because they want their children to start therapy, which I think is great. But we need to hear directly from the students. We can't kind of schedule an appointment on behalf of a student if we don't hear directly from them. But we're always happy to take calls from parents and provide any information. Sometimes parents feel like, if they get some information, or maybe they can refer students to websites. I guess I should say parents, guardians, anyone who's kind of helping a student out. Sometimes, they need a little bit of extra information that might nudge them in our direction, so we're always happy to help with that. Let me think. Another thing we do is we often get calls from parents, professors, other places on campus when folks are concerned about someone on campus, concerned about thank you very much. Someone just posted, I got our Instagram right, and it's our number.
Yes,
and
I'll
maybe
do the same for each of you today, if that will help.
Cool. How about, can you add our website? That would be awesome.
I sure can.
All right. Let me think. Yeah, so one of the other common calls we get is when a parent, professor, someone else on campus is concerned about a student. Because of confidentiality, we don't necessarily reach out to students. We'll always accept information because that student may be a client at CAPS, and so that student can inform the treatment we give. But we also often encourage folks to contact the care team. And I don't know if anyone on the panel is going to talk about that a little bit today, but the care team is a group of some of the leaders on campus whose job it is to kind of identify and care for students who are having a particularly hard time or might be noticed in different areas of the campus community. Maybe they're really struggling in classes, maybe they're really struggling in the residence halls. maybe a particular professor had office hours and is concerned about that person. So the care team is a place, and actually if you could get some care team information up, that would be really great too. A care team is a place where we kind of gather all that information together and talk about how best to reach out to and support that student. But again, you can always start with CAPS and we can kind of direct you to the right place to go. I'm trying to think if there's any other general information. All right, we got our website up there, and I'm happy to answer any questions. So if there is something that, oh, I guess I should always say our services are free. So don't worry about cost being a barrier at all. I think that's a common question we get. All right, anything else, please let me know and I'd be happy to answer any questions.
Thank you. Should I choose, or who would like to go next? Dr. Anderson?
Sure, I'll be happy to go next. Good morning, I'm Kathy Anderson. I'm a family practice physician and I'm the interim director of the Student Health Center. I've been working here at Sonoma State University for almost exactly 12 years after being in private practice for about 20 years in Sebastopol, a small town about 8 miles west of us here. The Student Health Center is funded by student health fees. So your students pay a mandatory fee each semester for our services. And I always tell students and parents that we're probably the best bargain on campus because we actually can provide, excuse me, quite a bit of primary care, semi-urgent and urgent in nature usually. And we are available to students Monday through Friday from 8 to 5. We are staffed by a group of physicians, family nurse practitioners, supported by registered nurses, medical assistants, and then we do have some special services that are part of the health fee that are help us to provide a high level of high quality primary care for students. So we see the same sorts of problems that family doctors do in the community, everything from sore throats to injuries, all kinds of illnesses. We've been very much involved with the public health aspect of COVID on campus, and I'll address that after I describe our general services. We have had to make some changes because of COVID. We usually accommodate students on both a walk-in basis, but we do work through appointments. We have access to x-ray services. We have a small laboratory where we can, for students who are on campus, we can do some basic labs that support what we do here, such as checking for strep throat, checking for a UTI, pregnancy tests, basic services, including something that's a little more than what a doctor's office can provide. We can do what's called a complete blood count, which can help us identify what kinds of illnesses might require a higher level of care. And then we're very connected to the medical community in Sonoma County, both private physician practices as well as local urgent cares and emergency rooms. So we're often the point of first contact for any health issues that students have. And we are not in health insurance. And in fact, health insurance is not required to utilize the services of the Student Health Center, but it does supplement the services we provide. So for instance, if a student has Medi-Cal, Kaiser, Sutter, any sort of health insurance, we can help students if they do need services beyond our scope of practice. We can connect students with follow-up care in the community. So it is important for students to know what health insurance they have access to, and we encourage students to have a picture of an insurance card on their phone so that they can access that information if they're consulting with one of the providers here at the Student Health Center. The health fee covers virtually all the primary care we offer. There is no copay when students come in. Our laboratories services that we provide in-house are covered under the student health fee, so there's no additional charge. X-rays that we can provide or can perform are again covered under the health fee. Our pharmacy provides prescription medications and over-the-counter medications, basically at cost. But it's a limited formulary. We only stock the prescription items that we most often prescribe. And our pharmacy can only fill prescriptions that are written by our providers. So your student, let's say they're on a medication for acne from their doctor at home. They could not bring that prescription to our pharmacy, but we may be able to help in that if the student makes an appointment with one of our providers and it's something that we carry in our pharmacy, we can certainly fill or write a prescription that could be filled at our pharmacy. All of our providers are licensed in the state of California, so you could take our prescriptions to any outside pharmacy. And that includes CVS, Walgreens, all of the above. Kaiser is a little bit of a hybrid. Kaiser will fill a prescription written by a non-Kaiser pharmacist. However, and there's always a but, they may fill them at a higher price or cost to the patient than if they were written by a Kaiser provider. So we can often help students navigate that dilemma when it comes to a prescription need that they have. Let me say that prescriptions at cost mean that things in our pharmacy usually are $5 to $10. And so that is often, it's more convenient and very inexpensive for students to fill prescriptions right in our pharmacy. We do also collect laboratory specimens that for things that we don't have the capacity to actually run the test for, but we can collect the specimens, and we get a hugely discounted rate for tests that are sent to an outside reference laboratory. And we use Quest Lab, which is a large national laboratory. And so students who, for instance, a very common test that we send out is for sexually transmitted infections. We collect the specimens here. The students pay the Student Health Center, we pay Quest. And in doing it that way, students are, again, access these tests at a hugely discounted cost. And it's much more convenient, again, for students to work with us. So how have we adapted to COVID? Well, we've had to make a lot of changes from the very front door and on back, in that in the past, when we've allowed students to walk in, it did not allow us to basically control the contagious aspect of any infection. So now we ask all students to contact us by phone first, and that includes if they want to utilize the pharmacy. And then we make sure that we are directing students appropriately, that they're entering through the correct door so that we can mitigate any risk to both our staff and to other students who may be in the building in terms of exposure. All of the staff in the building are wearing masks, and usually I have a mask on, but I figured this might be a nice time not to have a mask on so you could see me. So I'm in my office with the door closed. But we're practicing all the appropriate public health precautions in dealing with the pandemic. We have been practicing telehealth, as most primary care physicians in the rest of the world are. And that means students call us. They are speaking with a medical assistant or RN on the phone. We can help direct the student, including to an appointment with one of our providers. That telehealth visit can be conducted by telephone or through Zoom. And so we have that capacity to use healthcare Zoom, which is HIPAA compliant and very confidential, and accomplish a great deal through a telehealth visit. Sometimes, though, there are things that do need to be seen face-to-face. Either the doctor or nurse practitioner feels the patient does need to be examined, or we do need to do some testing. If the student is local, either on campus or living off campus but close by, then we would make an appointment for the student to come in, and everything is conducted with appropriate public health precautions. Our staff has adequate personal protective equipment to protect themselves and the student against any contagiousness. If a student is away from campus, as many of our first-year students will be this fall, we still can help your students. We're encouraging students, whether they're local or remote, to call us. We can do a telehealth visit. And again, this is under their student health fee. And so there's no copay or cost. We can arrange, let's say, for a good example, common example is urinary tract infection. So if we're talking to a student patient on the phone and they have all the symptoms of a low risk urinary tract infection, no concerns about a kidney infection, no fever, nothing that would require an actual face-to-face visit, but would require us to collect a urine specimen. We can direct a student anywhere in California to a local Quest laboratory. We can place the order through the computer, isn't it wonderful, to the Quest system. The student walks into the Quest lab in San Bernardino and gives a specimen and goes home. The results will come to our provider here through Quest, and then our provider would contact the student and say, yep, you have a urinary tract infection, and then our provider can call in a prescription for the appropriate antibiotic to a local pharmacy in San Bernardino so that that student gets what they need. The student can follow up then with the provider by phone if there's any question or concern. And if there was something that was more involved that would require a face-to-face visit, that student in Southern California would be directed by our provider to a local CSU health center. There is a reciprocal arrangement amongst all 23 campuses that student health that's available for any student on any campus. That student can be seen at any student health center. It's important though that the student access care first through their home campus, because that's who that student is paying the student health fee to. We can verify the student's eligibility for student health services, but then we will smooth the way to making a connection with another health center. Our staff would contact the staff, say at CSU San Bernardino, since we're using that example. That student health center would then contact your student and make arrangements for that student to safely have a face-to-face visit with a health provider at that campus. Our staff would forward through confidential methods the history, the telehealth visit that we had with the student, any pertinent allergies, medications, and so forth. So that's a very seamless handoff of medical care to a local health provider. And again, this is all covered under the student health fee. So the student would not pay a copay at San Bernardino's Health Center. They would receive the same basic services at any student health center within the CSU system that they would have usually here at Sonoma State. So I'm going to stop talking and leave plenty of time for questions, but that's in a capsule version of what we do at the Student Health Center. So thank you.
Can I jump in and add something real quick? I forgot to mention that we also do our therapy, both group therapy and individual therapy and workshops by phone and by Zoom. That was a good way to add it. And I'm gonna throw some of the workshops and groups information, like some sample topics in the chat. So if you're wanting to take a look at them or show them to anyone that you're helping out, you can do that.
Thank you so much. I have one quick question before I introduce our university police. Danielle wants to know if they can email or text for an appointment.
The quick answer is it's better to call.
Great.
That I would just say, just call. We do have a health center email, but it is monitored every day, but not often in as timely a way as it should be for a health issue. So we encourage students to call 8 to 5, Monday through Friday.
Thank you.
And at CAPS, we also are set up to do it by phone. We're working on trying to figure out a way to book online. That's something that we may have set up at some point, but the old-fashioned way phone is what we got right now.
Wonderful, thank you.
And I'll add, since Andy did, that when we're fully functional and prior to COVID, students could make appointments through our health portal. We have a secure health portal to communicate with students, and that does allow for some appointment scheduling, but we've had to turn that off right now because of COVID, and that will eventually, be resurrected. So thanks.
Wonderful, thank you. And last but not least, our Chief Weaver and Lieutenant Swicegood from our University Police Department.
Well, thank you. And on behalf of everybody at the University Police Department, welcome to the Sonoma State community. We're glad that you're here, and we're looking forward to serving the students that arrived this fall. Let me quickly introduce myself. My name is Jeff Weaver, and I'm the interim Chief of Police, meaning that I'm bridging a gap between the former Chief of Police and the Chief of Police that's being hired right now. So I've been here for 3 months. I'll be here for another 2. And it's been my pleasure to join the University Police Force after a 30-year career elsewhere. Just a few things that I'll share quickly, and then I'll ask Lieutenant Swicegood to introduce himself and add anything he feels appropriate to add. The first is that the University Police is a 24/7, 365, fully sworn, fully authorized police department that's here to serve the campus community. Our primary responsibility is to make sure that students can learn in safety, that teachers can teach and research can happen in safety. And so we're here to preserve the educational environment for everyone, students, staff, and faculty, and that's what we do. Our dispatch center is answered 24 hours a day, 7 days a week, 365 days a year. Our phone number is easy to remember. It's 664-4444. During the week, Monday through Friday, we answer our own phones, but during other times, they're answered in the city of Cotati, which is a small jurisdiction just west of us. And so we have professional dispatching services available to us 24 hours a day, 7 days a week. We have tremendous partnerships here on the campus and off the campus. For example, we work closely with CAPS, part of the presentation today, the health services folks, the Title IX officer. We have a sexual assault advocate assigned full-time to the campus. And off of the campus, we have law enforcement resources and advocacy and support resources as well. But we don't hesitate to work with these partners and bring them in to help support, so we can all support each other's efforts. The final thing that I'll share before I ask the lieutenant to introduce himself is that our authorized strength is 13 sworn police officers. The lieutenant and I are 2 of those 13. The other 11 wear uniforms and drive patrol cars around the campus. And I'm happy to report that as of 2 weeks ago, we are fully staffed. So we are prepared to welcome the incoming students as they populate the dorms the 14th through the 17th and return to classes, whether in person or online, right after that. But again, on behalf of all the women and men that are here at the University Police, welcome. We're glad that you're here. And Lieutenant, if you can introduce yourself and fill in any gaps I might have left.
I am Lee Swiskid. I've been with this department for 16 years. And in that time, I can tell you that this is a safe campus. We're not immune to anything happening that is crime, but the crimes that we do see are typically not violent in nature, mostly crimes of opportunity, such as if you leave out your laptop and go away to go to the bathroom, there's a possibility that that laptop could be taken. We have a detective that we've just started about last semester. So we have the ability to investigate in any form of crime. And we also work, as the chief said, closely with other agencies. So mutual aid between us, sheriff's office, neighboring police departments, and we back them up as well. So we are fully sworn police officers, have arrest powers throughout the state of California, but we are here to serve Sonoma State University. This is where our paycheck is. This is where we are paid to be. So this is where we are 99% of the time, unless we're, called out to help out another agency. And with that being said, those agencies are also just a call away from us. So for instance, there's a code on the radio that I could say, and I could summon, 40 to 50 police officers within literally a matter of minutes. So we are very well connected, and our officers are also very well trained. It was mentioned about sexual assault crimes, and I think 9 of our officers have received training that allows them to testify as experts in sexual assault in court. So we have very well-trained officers, very capable officers, and your students, we want you to know, are going to be in very good hands. With everyone here is out to make sure that students are safe and students are healthy. So we appreciate your confidence in sending your students to us, and we don't take that lightly. We are here to serve them. And the chief mentioned our non-emergency phone number, which was the 664-4444, but also just to let you know, 911 is our other number. So any calls from 911 that are within the span of our jurisdiction will go directly to our dispatch center, and we will respond to those as well. And then any other questions, we'd be happy to answer. Thank you.
And with that, thank you all. I will turn it over to our parents and guests and guardians here with us today. Again, feel free to use the chat function, which we have put in a lot of information in there. This recording will also be into your online orientation. So all of these things will be saved for you. Chat function or Q&A function, or if you would like to ask our panelists a question, just use that raising hand feature and I will turn your camera on, or allow you to turn your camera on. while our parents and guests formulate their questions, I am going to fill in one gap. There is a person who is part of this care team. All of the people you see are on our care team here. And it has been mentioned a little bit about sexual assault and survivors. We do have two dedicated confidential advocates who work in connection with our counseling and psychological services, who are dedicated just for the student and who are a non-reporting party. I will let Dr. Carlo Myers explain a little bit better, but she is actually presenting to our students as we speak. So she's talking to your students about how her services support the responses and advocate for students, and it is accommodations that might need to take place in a residential village or in the classroom. She, like I said, is a non-reporting agency. There are two on campus. There's a brand new one. Susan Polito and Brittany Kern, I believe is her name. I'm still learning it. I met her for the first time Monday. But they are there to help your student thrive and survive after a situation that might not be a pleasant one to have gone through. They do not report to Title IX Jean Cleary Act requirements. They are not required to tell the police. They are not required to tell anyone. They will follow the lead of your student. And that is for those who might have suffered sexual assault, dating violence, relationship violence, both on campus and prior to their arrival as Sonoma State students. If they just need someone to help them, those folks are there too. If I missed anything, please feel free, but I did want to let you know that there is someone like that on campus who is wonderful for your student, but is working with your students literally right now. So she's not on our call on this panel. Again, I want to turn it over to you now that we've talked your ear off. We have about 25 minutes left.
If I could just make a comment. It's been a wild ride for all of us when it comes to COVID. And I just want parents to know that there is some information at present on the SSU website about COVID-19 and how the university has been responding in real time. But things are changing so rapidly, not only in our local county, but throughout the state, throughout the country, throughout the world, that it's been challenging for us to plan for how to respond both to risk factors that all students, faculty, staff, in terms of exposure to infected individuals, and then how are we providing care for those individuals, both on campus, off campus, remotely. And we have been working feverishly this last week because it's been hard to draft plans when the ground is moving underneath you in this pandemic. Just so you know, there will be new information that will be appearing on the SSU website next week. We're finalizing some of the information, understanding that we'll need to be updating it frequently. The Student Health Center website in particular will, for health-related issues with COVID, whether it's testing or exposure or symptoms, that kind of information will be front and center on the Student Health Center website, and we are updating that in the next day and a half or so. But we also are having a lot of input. We have another meeting today. We've had many meetings, and we have another meeting right after this almost for the Student Health Center leadership to work with the campus leadership on updating the SSU website and making it, I think, more user-friendly. We've been adding information as we've gone along, and now the COVID information, I think, is just overwhelming on the SSU website. So we're trying to narrow it down, have it be more of a landing page linked to other resources on campus, such as the Student Health Center, housing, counseling, UPD, making it easy for people to get. It's easier to update those individual web pages sometimes. So just keep your eyes open. We encourage students, and we'll encourage you as parents to check the SSU website frequently. Encourage your students to check their SSU email frequently, because one of the biggest challenges I've encountered as first a provider here at the Student Health Center and now as a director is how do we communicate effectively with students? It's always challenging. They don't answer their phones, we've discovered. They don't often check their email often enough, and that's when there's not a pandemic going on. Texting, we have the ability to text students, but it is an ongoing challenge. So if you can encourage your students to check their SSU sonoma.edu email 2 or 3 times a day, that would not be too often under the present circumstances, because that is a way for their professors to communicate with them. And that's, as a care team member, I can tell you one of the most common reasons that a professor will reach out to the care team is because during remote instruction, students just kind of disappear. They're not responding to reach outs from their professors. And then professors are left to wonder, is this student okay or not? And then as a care team, we have challenges connecting with students. So you as a parent, guardian, important person in a student's life, this is the time to really stay connected to the university, and the best way to do that is through their sonoma.edu email. So that's just been our experience. Thanks.
Thank you. We do have a couple of questions in our Q&A. We have a question that says, will students be tested for COVID upon arrival?
Mute myself, there we go. The answer is no. We have had a very close collaboration with Sonoma County Public Health back from January. I've been in frequent touch with the county, and we are led by a public health officer in Sonoma County who is brilliant, and she's on top of things. And there is guidance coming from the CDC for institutes of higher education, and that's been updated frequently as well. So one of the challenges we face today is accessibility to testing for COVID throughout the county. And this is not just Sonoma County, this is everywhere, both access to getting tested and then getting results in a timely way. This is a national issue, and we are absolutely feeling it locally in Sonoma County. So having an accurate test, which there are tests out there that are very quick that you hear about that take 45 minutes. Those are called point of care tests. Frankly, from a physician perspective, those are just not accurate enough to be useful. So we have not adopted that sort of testing on campus, nor has it been adopted at, I won't say any CSU health center, but certainly not many, because of the lack of what's called sensitivity. They're just not good enough. And so the PCR testing, the nasopharyngeal swab that you've seen, if you haven't had it done to you, you've probably seen it on television. That sort of testing is something that is available through Sonoma County. It's actually available through the state of California, but in Sonoma County, there are 2 testing sites. The testing is free, but having access to it has become more challenging, I'll be honest with you, and it's one of those things that we've been watching very carefully. We do have the ability to do a very limited amount of testing for COVID here at the Student Health Center. We are able to have our tests done through the Sonoma County Public Health Laboratory, which is restricted to only really first responders, contact tracing testing through known positive individuals in Sonoma County. But we have been able to arrange through to have our tests done through the county public health lab, where the turnaround time is still 1 to 1.5 days. But we have limitations. There are limitations in terms of the swabs themselves and the media that carries the swab, that the swab goes in is carried to the lab. So we are limiting our testing to students who are symptomatic with symptoms that we feel make them likely to have COVID, particularly if those patients have any underlying health conditions such as asthma or diabetes that would make that student patient be at higher risk of having a more serious reaction to COVID. So that's how we are narrowing down who we feel it's appropriate for us to test. We will help students identify where they can be tested, but the timing of doing a test, particularly in a patient who has no symptoms, is really important. And so our feeling was, and this is guided by public health recommendation, that if we just test every student who comes to campus, we're not going to get very accurate information. We know that folks who will eventually develop symptoms if they're infected with COVID, we're most likely to get an accurate measurement of that from the 2 days before their symptoms began until their fever is gone, or 72 hours after their symptoms begin. So that's a fairly narrow window. If you test that person who has COVID, if you test them too soon or too early in the infection, the test will say they don't have COVID, but they do. Same as if you test them too late after their symptoms actually began. So this is a moving target, if you will, and we just felt it did not reach a measure that it was meaningful to test every student when they arrive. Instead, what we're doing is we're educating students about how to protect themselves and others that they come in contact with. It is a public health order in Sonoma County, and actually throughout the state of California, that people should be wearing a mask when they are outside their place of residence. Students who are living on campus will have a private bedroom with a private bathroom, and any shared surface or shared spaces within the apartment, kitchen, living room. If a student is outside their bedroom, they must have their mask on. They should be cleaning surfaces, and all of that kind of information is being collated right now and will be shared with students just before they arrive and as they arrive on campus. So we're trying to limit the spread of COVID, whether it's brought from your home county or it's acquired when students arrive here. And we do understand that young people are young people, and just like older people, they don't always make the best choices, but we're trying to arm your students with the best information and support, and they could always reach out to us at the Student Health Center, and we encourage them to do that, but also housing staff are being educated, and as are other staff and faculty on campus. So hopefully that addresses that question.
That is actually a great segue into our next question, basing off that a little bit. What action plan is in place for a student that does test positive for COVID? Will a student have to move out of their dorm if it's a roommate?
Again, we have that, we're finalizing those plans. And unfortunately, I clicked away earlier, and I apologize because I forgot to mute myself. I'm getting all these emails in. We do have a plan. If a student has been exposed to, anybody has been exposed to someone who is known to be COVID positive, and exposed means close repeated contact, less than 6 feet for more than 15 minutes, and the infected person does not have a mask on. So that obviously could be in a roommate situation, although it shouldn't be based on what I just told you, and that students who are closer than 6 feet should always have a mask on, and we're trying to limit that. The mask does not obviate the need to still maintain social distancing, even in a living situation. And we know this is going to be challenging. So we do have plans. A student who has been exposed has to be in quarantine, self-quarantine. If a student is actually positive, has been tested positive, they are in what's called isolation. They really look very, very similar. We are fortunate to have adequate physical space in the dormitories on campus, that we do have a designated dorm area for students who have to be quarantined or isolated. And what I can't tell you is there's no cookbook for who would have to move. Somebody's going to move out of an apartment where a person has tested positive. It is likely going to be the positive student would be moved to an isolation apartment. We have all kinds of provisions set up for food getting delivered, for maintenance issues that come up, for cleaning supplies. We have student-facing information that the student would be given as to, they would have to take 14 days worth of clothing, medication, everything they need from their own personal space would travel with them in one trip to their isolation apartment. Contacts, we would be connecting with them on a daily basis from the Student Health Center. We want to make sure they have a thermometer so they can monitor their temperature, that they have all the information they need to know how to contact us, as well as student affairs professional staff who will be the kind of check-in person at least a couple times a week to make sure the student has everything they need in isolation. Students in quarantine, so let's say that student who is testing positive has 2 suite mates. These students have their own private bedrooms, private bathrooms, but there is some shared space that they could have been in during an infectious period. And so those students would be given slightly different instructions on what to watch out for. They would not be tested automatically, but we would be monitoring their symptoms, and they would be tested if it was appropriate through the Student Health Center. But then whether those students would move individually to a different apartment or not, that would depend on the circumstances. And we will be consulting with public health, if I should say when, not if, but I'm trying to be optimistic, if we encounter that situation. So we do have a plan. We have lots of support in place for students. We'll make sure they know who to call if they need anything. What we wouldn't encourage, we can't allow, is for family to come and take a student back to their home if they're COVID positive. That is not a good public health practice. And we would talk to parents, you know, and make sure everybody's on the same page. But just to suffice it to say that we do have plans in place that are being finalized based on what's going on in our county right now to help minimize risk to every student, staff, and faculty person on campus, but to make sure students get what they need.
Thank you. One of the things that I would like to ask about, and for all of you who might be able to weigh in on, is, God, not to be doom and gloom, but about emergency response systems, because Sonoma County also is in PSPS territory, public safety power shutdowns or wildfires and air quality. In the chat, I'm going to put in the way for non-students, so parents and guests, to opt into our emergency alert system. But could someone talk a little bit about that emergency process and those emergency alerts?
I can speak to that. So we also, at the PD, we work closely with risk management. And so if there's a disaster on campus, such as we recently had wildfires, not on our campus, but in the county. And so we were very prepared to be able to evacuate, get students to a safe place, and coordinate with risk management. So part of that coordination is that we would open up an EOC, which is an emergency operations center, and we would have a dedicated phone lines for parents to call to check in on students. But the best advice that I would give you is to register for this notification system, the emergency notification system that Colleen is going to put up here. And that opts you in, excuse me, that opts you in to receiving text messages and phone calls regarding anything that's going on the university that is of a major concern, so that you are notified and you have information about what's going on here with your student. I would also reference you to the sonomastate.edu website, because just like with COVID, there will be a lot of information on that website that you'll be able to reference. Just like right now, the very top page of the sonoma.edu website has a link to all the COVID information that's available. That same information would be available for any other type of major incident at the university.
Thank you so much. I did put that information in the chat. It's as simple as texting 67 or SSU alerts to 6728. I also want to encourage folks who might not be residing in Sonoma County to also opt into our Nixle alerts. That is, I believe, a statewide program. I'm not sure if it's national or not, but to opt into Sonoma County Nixle alerts for the area that are not just Sonoma State contained things, but it's an early warning system as well.
Can I ask a technical question? It might just be my Zoom settings, but I'm finding that I can't copy things from the chat and paste it anywhere else. I don't know if anyone else is experiencing that, or if that's just something on my side.
You're wanting to copy from the chat and paste somewhere else?
Yeah, just if I was interested in copying, say, the information someone put on the chat and pasting it into a email or a document. Okay, so it sounds like at least one of the participants is able to. That's good to
Yeah.
know. It might just be something on my side. I just want everyone to be able to keep the information.
Sure. Well, and same goes for you. If you need any information, I am happy to provide it to you as well. We do have a few more minutes. Are there any other questions? Danielle says she tried this text for the emergency alerts. It did not work. All right. I will try to find some updated information and I will try to repost that for you also. There is a long page about it. I tried to find some of the easier snapshots, but as things change, I don't know if that is the most accurate place. Here is the website in general for, or not, for opting into those emergency services. Well, if folks don't have any other questions, I will thank you for your time today. Parents and guests and guardians, this is not the end of the conversation about taking care of your student. If you're thinking about this presentation later and you start to think, gosh, I wish I could have asked that, all of these folks have made sure that you know they are available for you as supporters of your student, and you're now our Seawolf community, and so we are supporters of you. Please feel free to reach out. I want to thank our panelists today for all of the information. It's a lot of information and you have shared it wonderfully with us. And if we need to, I know that we are here to share more information when the time comes. So thank you so much for your time, everyone, and have a wonderful day. For our parents and guests who are still here, we do have your disability services for students appointment later if you'd like to join us there. And I want to encourage everyone here to join us at our closing ceremony on Friday afternoon at from 4 to 6 or 4 to 5:30 to celebrate your students. So thank you very much and have a wonderful day.